my name is Ariel, and I'm making this video to tell you a little bit about myself and about appendix cancer and about a awesome workshop that I have coming up in 8 days. So my name is Ariel. I am a 15-year certified personal trainer, group fitness instructor, yoga instructor, and am currently in a medically focused massage therapy program. I've been passionate about health and wellness and movement and sports my whole life, both personally and professionally. Almost 4 years ago, I was diagnosed with stage 4 appendix cancer that had metastasized to most of my abdominal organs. And I want to tell you a little bit about appendix cancer and why it's a little bit different than a lot of other cancers that you hear of. So appendix cancer, or mucinous type cancers of the appendix, PMP cancers, there is the acronym for it. It's a Latin acronym. Don't ask me to pronounce it right now. But they refer to these cancers that grow on the surface of the peritoneal lining of the abdominal cavity and the surface of the abdominal organs. So appendix cancer is a little different in that it's oftentimes unrecognizable on scans. A lot of times it's not caught until it's stage 3 or stage 4 because of the way that it grows and it spreads. It sort of is similar to spray paint on the surface of the abdominal organs, and therefore it doesn't show up as like a tumor mass, how you think of a tumor might grow in other types of cancers, where you get a CT scan and you see a large mass. Oftentimes the masses with appendix cancer you don't see until they're a lot bigger. Something kind of unique to appendix cancer and other types of abdominal cancers is that we deal with a lot of scar tissue because it's not typically like one mass that comes out, because it's kind of spray painted around in the cracks and crevices of all the folds of the tissues of the abdominal cavity. It creates a lot of abnormal tissue and therefore adhesions. Because as that cancer dies off, it becomes scar tissue. And for those of us who have had various surgeries that involve chemotherapy into the abdomen, some of which have had the MOAS surgery, also nicknamed the mother of all surgeries, where they pour hot chemotherapy straight into the abdominal cavity to touch right on the surface of the organs, or like myself, PIPAC, which is high pressure aerosolized chemotherapy that they inject straight into the abdominal cavity through ports. Both of these types of surgeries involve chemotherapy, toxic stuff right on the surface of your abdominal organs. That creates a whole slew of issues with scar tissue, not just superficial scar tissue like this that happens when you cut into the skin, but also the scar tissue that's created on the inside, along the intestines, on the liver, on the diaphragm, on the bladder, on the other organs that are present, if there are organs present. A lot of appendix cancer survivors have had many organs removed, including myself. I've had a full radical hysterectomy. Anyone who has appendix cancer has probably had something similar. A lot of us have had organs removed. One thing that I noticed both in myself and in getting to know other appendix cancer survivors is something that isn't spoken about enough, in my opinion, is scar tissue and how our tissue heals, and how the collagen fibers and both internal and external can be healing and repatterning long after surgery, and how we can affect that repatterning and we can affect that healing process in a positive way. even if it's been a long time since surgeries or other invasive procedures, chemo, or anything else. So I am not a scar tissue expert. I am a personal trainer. Like I said, I would say I'm a movement expert. I'm getting to know a lot more about anatomy and physiology in general, and pathology as it relates to hands-on manipulation of the tissues. But so I speak from that lens, as well as from the lens of a survivor myself, and someone who has used a lot of different modalities to help myself stay well and continue to keep moving and to keep my health up during this healing time from cancer. I certainly don't claim to have all of the answers. All I know is that for the most part, I feel amazing. I have struggled a little bit with bowel obstruction type symptoms due to scar tissue and things of that sort. And so I certainly don't know that I'm totally out of the woods, and things with scar tissue and movement, they need to be kept up with, right? Our bodies are meant to continue moving. So I feel like I have a lot of information that I'm really excited to share, and I feel like I could go on, but I just wanted to make this video to invite you to the workshop that I'm hosting. It's a 90-minute workshop, and it's taking place next Sunday, May 4th, and that's at noon Mountain Time. I'll attach the link to this, and it's totally free. It's donation based, and the donations, 100% of the donations go to PMP Pals, which is a nonprofit that supports appendix cancer patients and caregivers. And you do not need to be present to win. You do not need to be an appendix cancer or cancer survivor to donate and to enter. I'm going to be raffling off this really cool cooler backpack. Let me show you. It's pretty epic. It's this really nice cooler backpack that's really big and deep and sweet, and I'm going to mail it directly to your doorstep. If you win, every $10 donation, you get a ticket for the raffle. And again, you can tell all of your friends and family to enter. There is no other requirement besides every $10 donation gets a raffle. So I hope that you'll donate. I hope that you will share this event with anyone who you may find could benefit from it. This isn't just for appendix cancer folks. It could be from folks who have had a lot of surgeries and have a lot of scar tissue, or are on a healing journey where a movement practice and some more knowledge and information regarding tissue manipulation and how to affect your scar tissue and tissue healing in a positive way. Anyone who might benefit from that. So please, please, please invite your friends. Ask them to donate. I'm sending so much love to all of you, and thank you so much for your support. Can't wait to see you all next week, Sunday.